We are very encouraged by the Commissioner's remarks, and we thank her for spending the morning with us. We hope to invite you for future conferences. Thank you very much. We are also encouraged that she's actually implementing the principle of community engagement in the new administration, and we are very proud of that. Thank you very much. I now take the opportunity to invite our Dean of the College of Medicine, Dr. Ian Taylor, to the podium. Dr. Taylor is also the Senior Vice President for Biomedical Research for SUNY Downstate Medical Center.
It's my role really to welcome you all to Downstate Medical Center. I'm not going to say a lot, but I do want to put our medical center in the center of what is an unacceptable stain on our current healthcare system, and that is healthcare disparities. We're in the epicenter, in my opinion, of healthcare disparities. As we've already heard and we'll hear from others, it's a very complex issue. Obviously, poverty is a huge player in this unacceptable component of our nation. But one of the factors is undoubtedly that the physician workforce of this nation does not reflect the broad diversity of the United States. Disparities is important to Downstate because it's important to the communities we serve. I'm particularly proud of the fact that last year, with the entering freshman class, Downstate became one of only a handful of schools in this nation that is now minority majority in terms of its student body. And that handful includes the 4 traditionally black schools. So we're the only non-traditionally black school that is now minority majority. It's something I'm extremely proud of, and I think our admissions process, etc., and the fact that we like our student body to reflect the broad diversity of New York City and Brooklyn in particular leads to that distinction. Coupled to that, we rank in the 96th percentile out of 141 US medical schools in the number of African American physicians we graduate. And again, that includes the 4 traditionally black schools. I think one of the factors that attracts minority students to our school, and this comes out in the AAMC surveys, is that they do see a diverse student body. That is not true for most of our medical schools. They also see a diverse faculty. We rank in the 93rd percentile in the nation in terms of African American faculty. Again, something we're very proud of and we believe gives a distinction to our school. It's sometimes surprising for people to realize, given how many medical schools there are in New York State and New York City, that we are the largest producer of physicians for Brooklyn, for New York City, and for the state of New York, which is a state that loses physicians every year. Just recently, the National Licensing Board put out figures for schools, and they rank them in terms of their importance in terms of currently licensed and practicing physicians. And this really surprised me because we are not the 4th largest school in the country, but we are the 4th largest producer of licensed physicians currently practicing in the nation. So this is a school that does its best to produce, and I'm the Dean of the College of Medicine, so I talk about the College of Medicine, but every one of our schools is diverse. Our nursing school, our School of Allied Health, our School of Public Health, our graduate school, were all amongst the most diverse schools in the nation. And I think where we can contribute to trying to deal with this stain on our healthcare system in a multifactorial way. The Disparities Center, our connection to Arthur Ashe. Arthur Ashe could have put his institute in any medical school in the country. He chose Downstate because he realized that our medical center cared about our community and cared about some of the diseases that are so prevalent within our community. Some of the earliest work that led to the amazing ability to stop transmission of HIV from women to their babies was done in this school. We've got many firsts where we've made a huge difference, and the fact that now HIV-infected women can have children that do not carry the HIV virus is a huge change, and I cannot imagine how a mother would feel passing on that virus to her child. And the fact that now that can be stopped with adequate treatment, a lot of that research came out of this institution. So we are very proud of our role, not only in producing a diverse healthcare workforce, but in terms of the research, our connection to the Arthur Ashe, and the fact the NIH and the urban universities identified us as an institution that they should fund because of our work to try and decrease disparities in this nation. So I want to welcome you all. Sometimes I feel like a preacher, you'll have to forgive me, but I am extremely proud of this school and what we do. So I just want to give you a flavor of that. Unfortunately, I have to run off to a meeting myself. I wish I could stay with you, but please enjoy the symposium. This is a very important topic for Downstate. Thank you.